Good evening and welcome to tonight's Medtronic Diabetes webinar. Tonight we'll be talking about handling diabetes as a teenager, and joining us will be our two guest speakers, Dr. Jane Holmes-Walker and Medtronic Patient Ambassador Chloe. My name is Dean Kanakis. I'm a part of the marketing team here at Medtronic Diabetes Australia, and I'll be your host for tonight's event. So guys, just before we get things kicked off, if you do have any questions that you'd like to ask us, feel free to reach out to us through our social media channels. You can reach us on our Facebook page, Medtronic Diabetes Oz, the post we've got going there, or via Twitter using the hashtag 640G webinar. Okay, so I'll get into our introductions now. Our guest speaker, Dr. Jane Holmes-Walker, is an Honorary Secretary of the Australian Diabetes Society. She's the Clinical Associate Professor at Westmead Hospital for the past 18 years. A PhD in 1999 in mitochondrial DNA mutations and diabetes. She's also been involved at a national level, developing guidelines for insulin pump therapy, working with experts across Australia. Thank you for joining us, Dr. Jane Holmes-Walker.
Thank you.
Okay, so our next guest speaker is Chloe. She's an insulin pump advocate here at Medtronic Diabetes Australia. She's an active 13-year-old living with type 1 diabetes and has interests in rock climbing, wakeboarding, athletics, swimming and acting. She's currently in high school, just finishing her first year of Year 7 and managing her diabetes with the MiniMed 640G system. Thank you for joining us, Chloe.
Thank you.
All right, so into our first question. This one's for you, Chloe. Did you find the transition from injections onto the pump easy?
Yeah, I found it quite easy. It was a lot easier for me as a kid because there was a lot less pain and a lot less freedom to eat what I wanted. Like my friend Indy, who also has type 1 diabetes, she was on injections for a really long time, and then she transferred onto the pump, and she was kicking herself that she didn't do it earlier.
All right, thank you very much for that, Chloe. So next question for you, Dr. Jane Holmes-Walker. So we've got a little technical difficulty here. Just bear with us. There we go. So is it safe for my child to use the pump while I'm not there? And are there any safety features?
Okay, so I come from a transition background. So I look after people as they move from pediatrics to adults. So I think I'm going to focus my answer a little bit around the type of young people that I'm looking after. And it's really our responsibility looking after older children to make sure they know how to use the pump on their own. They don't need an adult to help them. A lot of times they might have been quite young when they went onto the pump, and their parents learned all the things about how the pump worked. But they go to school and need to use it independently, and then they might have teachers helping. But as they move into the adult world, really they've got to know how to do everything themselves. And so we kind of come from the assumption that people haven't learned everything on their own and how to do it on their own. And so a lot of what we do is about teaching them how to feel safe and secure on the pump in whatever environment they're going to be in, so that they can troubleshoot difficulties with the pump themselves. And that's a really important part of being on an insulin pump. The pump itself has a number of safety features built into it, so parents can feel reassured. For instance, you can set a maximum bolus limit so that they couldn't overdose on a bolus when they were going to eat, and an accident couldn't happen there. The pump itself will have alarms to alert the person if the insulin's not delivering, and if they're at school. I'm certain the school will get in touch with the family if there's a problem operating the pump and the young person's not able to sort it out themselves. So the alarm's going to go off if it's to stopping the delivery or if the battery's gone. And finally, there's always a thing called a lock screen. So if you really don't want anything to happen, you just can lock the screen so that it's not bumped during normal activities and doing things when someone's not really aware of what's happening. And they're all really important things to know how to set up, and for the young person to know how to set up, and also how to turn off again when they want to deliver insulin for a meal.
Thank you very much for that, Dr. Jane Holmes-Walker. So guys, just another quick reminder, if you do have any questions which you didn't get a chance to submit upon registration, please feel free to reach out to us through our Facebook page, Medtronic Diabetes Oz, or on Twitter using the hashtag 640G webinar. Next question for you, Chloe. Do you find it easy to use the pump without assistance from an adult?
Yeah, I find it it really easy. In the first couple of weeks I got a pump, I just had to check in with my mum when I was doing a bolus and stuff like that. But after a week or two, you really easily get the hang of it. Like sometimes you might need reassurance if you're doing like a temp basal or something like that. But for simple things like a correction or a bolus, it's really easy to do and you can do it all by yourself. Yeah.
Right. Thank you very much for that, Chloe. So back over to you, Dr. Jane Holmes Walker. So my daughter is beginning puberty and we are finding it challenging to avoid lows. How would a pump help?
Okay, so one of the main reasons a pump is helpful is the way it delivers what we call the basal insulin. So these terms are really well known by people who are on a pump, but the term basal insulin is not always very familiar to someone who's not on a pump. But if you like to think of the basal insulin, if you're on multiple daily injections, there's the insulins like Lantus and Levemir. And those insulins are better than some of our older insulins that we used to use, but they can deliver a fixed amount of insulin every hour over a 24-hour period. So if you think of your total dose that you take of your Lantus, you divide it by 24, that's how much you're getting every hour with your Lantus. So when you're on a pump, the great thing about a pump is we can change that background insulin to be different at different times of day. And as people cross into puberty, their body clock starts to develop a rhythm so that there are times of day where we need less insulin and there are times of day where we actually need more. And that's what people will often notice when they're on their background insulins, that in the morning their sugars are often higher because they're not getting enough insulin, but overnight they might be going hypo. So the beauty of a pump is we can change that background insulin. So that's the insulin that's working kind of 24/7 and it's got nothing to do with your eating. It's just the insulin you need there in the background when you're not doing anything at all. And we can change that on a pump to be lower at night or lower in the afternoon. And the other beautiful thing about a pump is that when we do unpredictable activity, if you've taken your Lantus the night before, there's not a lot you can do to change the dose once you've already given it. But the great thing about a pump is just before you're about to do an activity, you can actually change the delivery of that background insulin we call basal. And Chloe's just referred to that about doing a temporary basal setting. For instance, if she's going to be doing sport at school, she can set the basal insulin to go lower so that she won't go hypo during a sporting activity. So that's really helpful. The other thing is that as you go into puberty and girls might get menstrual cycles, they might find that they often get low during periods and then they're high maybe just coming into the period. And again, we can use this feature we call a temporary basal just to temporarily increase or reduce the delivery of insulin so that you don't get problems with hypos or high sugars at those times.
Very much, Dr. Jane Holmes Walker. So Chloe, just back to you there. Is setting a temporary basal when you're playing sport or doing some of those activities that we mentioned before, is that something that you've done in the past or currently do?
Yeah, I do that quite often. Like often I have a pattern, like if I go swimming in the morning, I often go low after. So to prevent that, I often put a temp basal on as soon as I get out of the pool to make sure I can stay focused at school and not have to go low. Yeah.
All right. Thank you very much for that, Chloe. So Dr. Jane Holmes Walker, back over to you for another question.
Yeah.
Why do certain doctors recommend the pump early on, but others want you to get better control with injections? Does the pump not achieve this?
Okay, so I'm going to come at this question from a number of different angles because I think the question lends itself to that. So the most important thing to know about a pump is that it's just not a cure-all. It doesn't operate automatically. It does require you to interact with it in lots of ways. And if you can't demonstrate really that you can get a hold of managing multiple daily injections, your doctor might be a bit concerned that a pump adds an extra layer of complexity. And if you're not doing all the day-to-day things on multiple daily injections, you do need to understand that a pump's not going to fix your problems. So a pump's going to give you the best results when you tell it what your blood sugar is, when you tell it when you're eating, and it delivers what we call the bolus doses. So if you missed a bolus dose on the pump, it would be pretty much like missing one of your multiple daily injections. You're going to have high sugars that you're going to have to fix up later. Now, obviously, for a pump, it takes a lot of the thinking work out of what dose do I need to use when my sugar's high or how much I'm eating. But there are a few skills you need to learn to be able to operate a pump well. The other thing is that if you've got a high HbA1c before you go onto a pump, it is actually going to be a little bit harder to work out what settings the doctor's going to set up on your pump. So they might want to do a little bit of dose finding on your multiple daily injections first before they set you up on a pump. And finally, going onto a pump really requires a team of people behind the doctor who are going to help you go onto the pump. So it depends how accessible that team is. So a diabetes educator who's familiar with pump therapy, a dietitian who can teach you how to carb count and is familiar with how the pump works, and all of those different things. So it's not just a matter of you deciding you want to go onto a pump. You need a whole team to support you once you're on the pump to make sure that's going to operate well for you. So I think you don't need to have good control to go onto a pump, but there are a lot of reasons why having slightly better control as you go on is going to make that whole transition process better. But I will say that the studies show that if you have a high HbA1c and you go on a pump and you interact with it the way it's designed, you can get really good improvements in your HbA1c.
Right. Thank you very much for that, Dr. Jane Holmes-Walker. So guys, just another quick reminder to everyone out there, if you do have any questions which you'd like answered, please do submit them to Facebook on Medtronic Diabetes Oz. We've currently got a post up there for you. And you can also use Twitter via the hashtag 640G-webinar. Okay, so back over to you, Chloe. Have you found it difficult to play sports with the pump, or do you disconnect from the pump during?
Well, it really depends. If you often go low during sports, you might find it better to take it off so you can enjoy the sport and don't have to worry about going off the side and treating your low. But for some sports, you might generally go low after, and you might want to set a temp basal while you're doing the sport. The pump is quite comfortable to use during a sport. You can just adjust it around your waist, whatever, to make it comfortable, or you can put it in your pocket if that's easier for you to do. And you shouldn't have to let diabetes stop you from doing any sport you love.
Thank you very much for that, Chloe. So, Dr. Holmes-Walker, back over to you. Are there common issues you see with diabetes in teenagers?
Well, it's a pretty long list, Dean, so I'll try and work out where to start. I think my role as a health professional is really to help young people get diabetes to fit in with the multiple changing things which are happening in their lives just with being a teenager. So that might be going to doing some part-time work, might be going to full-time work, it might be changing from school to university or working and studying as well. And in the end, we really just want diabetes to fit in with that life and the things they want to do. And that can be quite challenging because school's really handy in that it has a really set routine. But once you leave school, all of those routines are kind of turned upside down, and we've got to be a little bit flexible about diabetes management, probably a lot more flexible than you have to be when you're at school. So that's what we kind of aim to do with mixed success. You've got to remember that teenagers have a lot on their plate and they're learning lots of things, and sometimes diabetes is kind of playing second fiddle to all of that, and finding time to do blood sugar tests or remembering to do all those boluses at just the right time can be difficult because they've got lots of other things on their mind and lots of other things they're wanting to do. And so sometimes we have to just adjust our expectations about what they're able to achieve in different situations. So unfortunately, this is a common source of conflict between parents and young people because maybe for quite a lot of time, parents have been reminding them to do things and the young people will do them. But suddenly when they're teenagers, they've got more important things, more pressing things to do. They've got to communicate with one of their friends, and that bolus or that test is kind of falling into the background. But in the end, we have to kind of accept that the way they're going to do it is not the same way that their parents have done it. I always say it's a bit like husbands and wives looking after their children. They do it in a different way, but it's not necessarily a right or a wrong way. But they do have to learn how to do it, and we're not going to be there all the time to remind them to do the right things. And I think in the end they get there, it's a little bit messy along the way, and we have to develop a little bit of trust that they're going to learn it along the way. And they might make mistakes, but we have to just support them through those mistakes and not get into blaming them. And I have to tell you that nagging them to test and nagging them to take their bolus and take their insulin at the right time just doesn't really help the problem. So I think it's learning how to just take a little bit of a backseat and kind of go along for the ride and just watch them kind of learn the ropes themselves, and then be there to really support them when things go wrong. And sick day management is really helpful for parents to still kind of keep their hand in there, because often they haven't had to manage sick days on their own. And the other thing is that when they're sick and sugars are high, we really just don't think very well when our sugars are high. And it's really helpful then to have someone just prompting through the steps of what you need to do. And finally, keeping young people out of trouble. It's really a time where we try to get young people to find health professionals that can take them through the journey, because they are a little bit less receptive to the things their parents say. They're looking for outside help. And so it's about finding a really good diabetes care team that you can trust. And a lot of pediatric services and specific young adult services will provide an after-hours phone support service. And young people learn best when they have to sort through a problem themselves at the time that it's happening. You know, it doesn't matter how much we teach them about what to do beforehand, about what you need to do when you get sick. In the end, it really helps if you can speak to someone when you are sick, and they'll take you through step by step. And then next time when you're sick, actually you know what to do. So it's all about learning in the context of the situation when it's happening when you're a teenager, rather than planning for the event that's going to happen in maybe 3 months or 4 months' time. You really need to have a stepwise approach at the time that it's all happening, because young people are very immediate and they plan for what's happening today and not so much for what's going to happen in a month's time.
Thank you very much for that, Dr. Harris-Walker. Okay, so look, I did just receive another live question. It was around, do you have any advice for particularly teenagers towards the later years in having alcohol and being on a pump, or just managing their diabetes during this phase?
Alcohol is a really common thing that comes up in our clinic about how to manage that. We focus on making sure the young person has their insulin before they go out with food, to make sure that it's not forgotten. If you're on multiple daily injections, we really encourage the young person to at least take their quick-acting insulin pen with them, and similarly people on a pump to take their quick-acting insulin pen with them, because if the technology goes down, or if you end up staying out all night, you're going to really need some insulin there to keep you going and to enjoy the party. So we always say make sure you have insulin with food before you go, and always make sure you have some insulin with you, so that if things don't go to plan, at least you've got some insulin, because you can stay out as long as you like, as long as you've got insulin with you. That's about making sure that your pump is loaded up with insulin, so that it's not got 2 hours worth of insulin, that your battery's working on your pump as well, and that's not going to go out when you're out. But you do have a backup pen just in case you get out and you discover your sugar's high and maybe your line's blocked on your pump, and so you're not getting any insulin, and that's going to be the end of the party if that happens. The other thing we always tell people is to make sure that when you go out, you have a friend with you who knows you have diabetes and knows about your diabetes. And you tell them that if you ever go out unconscious, not to assume that's related to your alcohol, but to always be concerned that it could be something to do with your diabetes, and that they should alert someone if that happens. And obviously, no driving when you're drinking.
Yeah, absolutely. Thank you very much for submitting those questions, Jenny H. and Michelle G. Okay, so back over to you, Chloe. Do you use the pump in the water, and have you had any issues while using the pump in the water?
Yeah, I have used the pump in the water. I especially use it just when you're chilling out in the water with some friends, just splashing about. You can often leave your pump on just to keep an eye on your bloods, like to see if you're going low or see if you're going high. But if you're like doing swimming laps or something, I would probably take it off, because you might send your blood sugar levels low. And if you're doing this just so your pump's not alarming, I suggest turning it on aeroplane mode and then your alarms won't be going off, and then you can switch it off once you get out of the pool. Yeah.
Thank you very much for that, Chloe. Okay, so back over to you, Dr. Holmes Walker. This question was submitted. My son is 17 on MDI and does weightlifting. Will a pump help him manage his levels through training, puberty, and day-to-day life?
Well, absolutely, because the great thing about a pump is its flexibility. And Chloe's been referring to different ways that she uses her pump in relation to exercise. And often the problem with multiple daily injections is you've got that basal insulin, you've given it the night before, and then you can't really plan for impromptu activities the next day. Whereas with a pump, that we have different ways of changing both the basal insulin and the bolus delivery, which means we can manage sugars much better in relation to exercise. And often with weightlifting, a lot of people would take their pump off just so that they don't damage it or get it knocked. But you certainly could wear it during weightlifting. And it's interesting, with very high intensity exercise, blood sugars often go quite high afterwards. And so people might find their sugars are better if they keep their pump on. But when the lows occur, and Chloe referred to this after the exercise, the great thing about a pump is being able to use that temporary basal where it might halve the insulin delivery in the background insulin. And we also teach them around maybe changing the bolus doses in relation to food that they're eaten after the exercise so that they don't go low later in the evening, because a lot of young people are doing that exercise in the evening. And then they're going to go to bed, and they really want to make sure that they don't go hypoglycemic when they go to bed. Also, weightlifters like using a lot of the supplements. And so that's really helpful to see the dietitian when you're doing some of the supplements and working out the carbohydrate content of those. And the pump will allow you to deliver your insulin according to the carbohydrate content. The other thing weightlifters do is do quite a high protein diet. We have to remember that the pump doesn't really count protein. And if you're just having protein, it is interesting. A lot of people will find they still need some insulin if they had a protein-only supplement with no carbohydrates. But it's going to be different from what you would use with carbohydrates. And you do need some help from your dietitian and your diabetes team to kind of work out what's the best way to dose protein when you're on the shake diets and things that a lot of the weightlifters use. And finally, I have to say that insulin is just a fantastic anabolic hormone. That's why all the weightlifters abuse it. And so using your insulin well in relation to exercise is really important if you want to bulk up your muscle, and insulin is going to be really important to achieve that. So if you're not taking your insulin correctly, you're not going to build up the muscle mass that you want with your weightlifting.
Thank you very much for that, Dr. Holmes Walker. A quick reminder, if you do have any questions you'd like to have posted, please reach out to us through Facebook page Medtronic Diabetes Oz or via Twitter using the hashtag 640G webinar. Okay, so back over to you, Chloe. What do you feel is the best advantage to using a pump over injections?
I feel that the best advantage is probably it's a lot easier to use. Like, you can be anywhere and just quickly get out your pump, put it in. Like, you don't have to go to the bathrooms to do it, or you don't have to get it out during lunchtime. It's a lot easier to just generally use, like, so you don't have to waste that time using it outside. There's lots of other advantages, like there's a lot less pain using it, like, yeah.
Yeah, thank you very much for that, Chloe. Just another quick question for you, Chloe. Just one we've had come in live. Have you found the pump has made school life easier for you?
Oh, yeah, God, yeah. It's made it so much easier because, like, you can just quickly get it out. You don't have to carry around all your insulin everywhere. It's just attached to you. High school is quite busy. You're always moving around classrooms, and often the teachers don't know as in depth about your diabetes because you have lots of different teachers. So having the pump, like, kind of makes it a lot easier, as you don't have to, like, think so in depth about it all the time. So it makes it a lot easier for you. Yeah.
I think, Chloe, we find a lot of patients in our clinic find they like the sense that they're in control, you know, before you're on the
Yeah.
injection, you have to go to find someone to say, I need to have my injection, or some schools
Yeah.
will insist you keep your insulin in a certain place in the school for safety reasons. But if you're wearing it all the time, people just leave you
You can
to
just
it.
do it.
And so there's a lot more
Yeah.
sense that you can run the show and you don't rely on the teachers as much to be able to give insulin when you want to, and the less inconvenience by having to go somewhere special to give your insulin because it's just there with you.
Mm.
Thanks, guys, and thank you to Janice B for submitting that question. So back over to you, Dr. Holmes Walker. Next question. What would you say to those living with type 1 and looking to gain better control through puberty and beyond?
Is that question for me?
No, I think we may have. Oh, Dr. Holmes Walker, are you still there? Okay, I think we might have lost her there, unfortunately. We'll just go ahead to the next question for you, Chloe. Jump back into this. So, what would be your one piece of advice to someone considering making the switch to an insulin pump?
My one piece of advice would probably be to trust it. You don't you probably need to have faith in it, and sometimes you might need to feel like you're double checking a lot, but sometimes you just need to trust it and rely on it. Always maybe sometimes that I struggle with is remembering when to change my set changes. So what you can do is put on your calendar every 3 days when you need to change your site change. This just helps you keep it in control, especially if you have a busy life. It's very easy to lose track of these things.
Pump has a reminder.
The pump has a reminder. So if you want to do a reminder, you can also do it on the pump. Yeah.
Right. Okay. Thank you very much for that, Chloe. I think Dr. Holmes Walker, are you back?
Yeah, just back.
Okay. Fantastic. Okay. We'll just, I think we're on to our last question here. So it's back over to you. What would you say to those living with type 1 and looking to gain better control through puberty and beyond?
Okay. Well, don't be beaten by it. There's multiple ways to fix a problem, and just work with your team to get that. Sorry, I'm getting multiple messages on my computer because I've just had to reboot it. My apologies. Sorry. That you need to use the insulin treatment that's going to suit you best, not what's going to suit your parents best, not what's going to suit your doctor best, but what's going to fit in with your life. So if multiple daily injections are the thing for you at the moment, go with that. And there might come a time later where pumps are going to fit in with your life better. So pumps aren't a fix for everybody. And for some people, they really dislike the idea of having something attached to them. But having said that, they can find later that that's not really an issue for them. For other people, having to do multiple injections every day is a real burden, and the pump removes that burden for them, and they find they have a new flexibility to their insulin regime that they didn't really have with multiple daily injections. But in the end, it's about choosing the right treatment for you, not the right treatment for your parent, not the right treatment for your health professional. You need to work through what's going to suit you best. And we'll support you, whatever treatment you choose is best for you, and we'll try and make it work for you. And if it's not working, then we look at what other solutions there are to that problem.
Okay, thank you very much, Dr. Holmes Walker. All right, everyone, that just about wraps it up for tonight's events. I just want to let everyone know, firstly, I should say thank you to our speakers. Thank you for joining us, Chloe and Dr. Holmes Walker.
Thank you.
Thank you.
I hope it was helpful for you all.
Okay, so guys, just a quick reminder, if you do have any more questions after this webinar, please feel free to reach out to us on 1800 777 808 or via our Facebook page, Medtronic Diabetes Oz. We've got a great team here at Medtronic Diabetes Australia who would absolutely love to help you with any questions you might have on pump therapy. Okay, so thank you very much and have a lovely evening.